I'm going to introduce Carrie Treadwell, who's our Chief Research Officer here. She's also the Managing Director of our Defeat GBM Research Collaborative, which is a subsidiary of our organization. And she also serves as a patient advocate for the National Cancer Institute Brain Tumors Spore Program. So Carrie, thank you so much for being here today, and take it away.
Well, thank you, Stephen. It's so great to talk to all of you about an initiative that's so close to my heart. The National Brain Tumor Society has a strong history of funding pediatric research back to some of the great discoveries that launched our understanding of medulloblastoma with our good friend here, Dr. Scott Pomeroy. But 5 years ago, our board decided that we needed to do more. And so they mandated that 1/3 of all of our research funding should be allocated to pediatric brain tumor research, which provided a wonderful opportunity for our pediatric brain tumor patients. We decided early on that we needed to have initiative-driven focus in order to have true impact, and so we started with an initiative called molecular profiling, where we funded great work in the DIPG area with Cynthia Hawkins and Dr. Baker, who you'll hear from later. We then moved on to a developmental neurobiology initiative where it had two prongs, one of which was looking at the natural history of the disease and trying to identify those trigger points where the tumors actually got started. The other prong was trying to protect the developing brain from the toxicity of current treatments, which we all know is just terrible. We funded 3 projects in that area. One was Dr. Scafidi, the other Dr. Weschler at Burnham, and Dr. Joyner at Memorial Sloan. And that initiative is coming down to its end. We have about another year of research. So that started us to think about what is next, what is required to really have true impact in this space. And we started to talk about a project that ironically is called Project Impact. And it's addressing the difficulty in getting new drugs into clinical trials. Over the past 20 years, there have only been 2 drugs approved for pediatric oncology, and we find that simply unacceptable. So for about 18 months, we've been talking to our advisors, we've been talking to friends of ours in industry, and government, and academics to identify the issues and the obstacles that were preventing these drugs from getting into our clinical trials. NBTS is putting the weight of both our public policy and our research programs behind this effort. There have been a series of meetings with key opinion leaders, and we have identified a clear path forward that will accelerate our ability to test and validate and ultimately graduate drugs into the clinic. It's an honor to work with Project Impact's 3 co-chairs. We're working with Dr. Packer at Children's National Medical Center, Dr. Susie Baker from St. Jude's, Dr. Miriam Fulati from Cincinnati Children's Hospital, in addition to some of our other strategic advisors, such as Stefan Pfister at Heidelberg, Nana Jabota at McGill University in Montreal, Raphael Russo from Genentech, and Peter Houghton at Nationwide Children's, as well as our scientific advisor, Al Young at MD Anderson. So we are all working closely together to drive this initiative forward to benefit the lives of our children, and you'll hear more about Project Impact over the next coming months.
With so many organizations that are focused on pediatric brain tumor research, will Project Impact partner with other nonprofits? And what about pharma and biotech groups?
Absolutely. So one of the wonderful aspects of Project Impact is that it's including everybody in the pediatric space, and we've been working closely with some of our colleague organizations. We know that we can't do this alone. We know we need to have strategic collaborative efforts and strategic partnerships. And so we're building this effort to make sure that we can include our colleague organizations, our friends in industry, and of course the folks that are key leaders in the government. We all need to be part of the solution to drive this forward.
Cool. And what can members of the brain tumor community do to support Project Impact?
Well, I think just participating in forums like this is certainly helping. We need to spread the word a little bit more about what we're doing in this space and what the unique needs are for our pediatric patients. Everybody's certainly surprised that we haven't done more. And so we need the help of our community to share what are the unique challenges that our patients are facing, as well as what NBTS is doing to move this forward. And we certainly have the right scientific questions. We have the right scientists. We have the right platform. We have everything we need to be successful. We just need to generate more discussion around this, and of course more support for our initiatives.
how can people get involved with the advocacy for pediatrics specifically?
Well, I know there are a number of projects that our public policy and our patient advocates are doing. Certainly can get to the website and sign up as an advocate. We have a Head to the Hill that we do every spring. That's a lot of fun. It galvanizes the community. We head to go meet with our representatives to let them know about some of the unique aspects of our community and what it is that they can do to help us. So I would encourage folks to get onto the website and sign up, and we will certainly be communicating with everybody who's interested about what they can do to help us.
Okay. Thank you so much, Carrie. We really appreciate you talking with everybody today.
Thank you.